Hello, my name is Nicholas Cohen, and I'm here to share with you the top 10 tips for people with asthma. Tip number 1, follow an asthma action plan. An asthma action plan is something that you fill out with your doctor, and it's a sheet of paper that tells you exactly how to manage your asthma. The asthma action plan will tell you what medications to take every day, as well as what to do in the event that you're having an asthma attack. So if you don't have an asthma action plan already, see your doctor about putting one together. Tip number 2, use a peak flow meter. Have a peak flow meter at home and use it every morning, as well as every time that you're having an asthma attack. You can buy a peak flow meter from almost any drugstore for about $20. The way to use the peak flow meter is to stand up straight, take in as deep a breath as possible, close your lips tightly around the mouthpiece, place your tongue under the mouthpiece, and then blow out as hard and as fast as possible. Breathe a few normal breaths and repeat a total of 3 times. Then take the highest number and record it. The asthma peak flow meter will allow you and your doctor to assess how well your asthma is controlled and will help guide you in the event that you're having an asthma attack as far as which medications are most appropriate. Tip number 3, take your controller medications every day. A lot of people will only take their asthma medications when they're short of breath. But if you have medications that are prescribed by your doctor that are called controller medications, which is everything but your albuterol inhaler, then it's important to take these every day, even if you're not feeling short of breath. These medications will prevent asthma attacks and are not useful when you're having during an asthma attack. Tip number 4, use your rescue inhaler when you're having an asthma attack. If you ever become short of breath, use your asthma inhaler. The way to use your inhaler is to breathe out normally, close your lips around the mouthpiece, and press down to release the medication. At the same time, inhale through the mouth deeply and slowly until your lungs are completely filled. This should take about 4 to 6 seconds. Then hold the medication in your lungs as long as possible, about 4 to 10 seconds before exhaling. Tip number 5, see your doctor regularly. If your asthma is not well controlled, and that means that you're using your inhaler more than twice a week during the day or more than twice a month at night, if your asthma is not well controlled, then you should be seeing your doctor at least every month to be adjusting your medications. If your asthma is well controlled, which means that you're using your inhaler less than 2 times or less a week during the day and 2 times or less at night per month, then you should see your doctor about no less frequently than every 6 months for further adjustments of your asthma medications. Tip number 6, don't smoke, and don't hang around people who do smoke. Smoking and secondhand smoke are some of the most important triggers for asthma attacks, and smoking causes many other health problems as well. So if you're smoking now, then ask your doctor about quitting and getting help. Tip number 7, identify the triggers, the things that cause your asthma, and try to avoid them. So asthma can be triggered by dust, by pets, by cockroaches, by mice. The ways to cut down on triggers is to keep pets out of the house, to not leave dishes in the sink overnight, and that way you'll cut back on roaches, to clean all bedding, including the sheets, pillowcases, and blankets, every week, either with hot water or on a hot dryer setting. Vacuum your carpet every week, preferably with a HEPA air filter attached. And if you have a choice, avoid having carpets in your house altogether. as well as drapes. If you can avoid it, avoid having drapes in your house, as these collect dust. If you have floors, mop your floors weekly, and dust off all surfaces in your house at least every week. You can also run a HEPA air filter in the room that you spend the most time, usually the bedroom. And you should use an air conditioner if you live in a humid climate. Tip number 8. If your asthma is triggered by exercise, then use your asthma inhaler, your albuterol inhaler, before you exercise. You should use 2 puffs about 10 minutes before you exercise. Tip number 9. Get the flu and the pneumonia vaccine. You should get the flu vaccine every year, and you should get the pneumonia vaccine twice, once before age 65 and once after age 65. And tip number 10, believe in yourself. You will have the biggest impact on the management of your asthma. And the steps you can take to control your asthma are simple and effective. So I recommend that you take these recommendations to heart and watch your asthma improve as you go. Thank you very much.